Can you give us examples of good data collection? And what data should charities be collecting and how?
Okay, I'm going to give you an example, and I'm going into the grant space here, but I also want to go into the evaluation space. What if you were to apply for a grant for a certain amount of money and ended up getting 60% more than you applied for?
Wow, tell us more.
I'm hooked.
One of our clients did that. And quite simply, it was because of the strength of the information in the business case, and it was backed up by data. The collection of information, it was a partnership of two, but they were both able to bring to the table enough data to justify the need and build that big case for the funding to go to them, but also and their capability of being able to manage the project as well, of their successes, and they were able to quantify that with data. And now I'm going to go to the other side and go that one of the ways of collecting data in the program space is through evaluation process. And again, I've got a client who's continually sort of getting project after project because they've managed to collect a lot of data that's proved the success of their previous projects. And I say to people, oh, tell me about a really successful project you did. And they'll tell us about it, and they're full of enthusiasm. And I'll say to them, prove it. Mm. And they can't because they don't have the data. So they've missed an opportunity to lobby, to go to the next stage, to apply for funding. There's lots of things you can do with that data, not just present it in a report at the end of the term to go to somebody else. But I've got to tell you a story of a new organization, newly incorporated, first time out for a grant. And I said to them, you need to prove that you've got this audience. So these people, it was a multicultural grant, multicultural youth. I said, you would need to get some real good data to back up why it should be you. They went out in a space of 10 days with a series of consistent questions, and they interviewed 267 of those people, and they went everywhere to find them, not just in one space. And their first time out, they not only got funded, but they got one of those presentation checks from the minister.
That's pretty.
There you go.
Very cool.
Excellent. And that brings to that point, I think, Rachel, when we were talking about just before around how important it is to know where to look for the data as well. So you can actually, you'll always find that there is data within a business. It's just maybe hidden somewhere in a platform or in a spreadsheet. I think, Trevor, you'd probably have experience with this where people have a lot of the information, it's just hidden.
Yeah, as we said earlier when we were setting up the meeting, that Excel spreadsheets are definitely a thing of the past. Even though for some people they're still the latest things in sliced bread, I guess. I was going to tip in as well that there's data sitting outside that can be brought into a business. And the example I'm thinking of is a not-for-profit that owned their own building and pre-COVID used to rent the hall out as a revenue source. And it's big enough to hold a couple of hundred people for a function of some sort. Think of the old-fashioned community hall for like a dance hall or something of that nature. And they're looking at what are they going to do when COVID is completely gone and they can have crowds in and not have to worry about shutdowns at a moment's notice and all that sort of thing. The starting point in my conversation with them was, well, you are all 55, 60 plus, and you all remember this region of Sydney for what it was when you all grew up. Let's have a look at the latest data around just the population statistics that are coming in from the ABS. And guess what? There were these ethnic groups that they hadn't even thought of that were clearly growing, and we're waiting for the next census, and I'm sure the trend's going to continue. And all of a sudden now they're targeting people from other ethnic backgrounds who are known to have big family gatherings, big social events in that sort of space. They'd never even considered using that. So it's not just data they collect in the organisation, it's matching what's out there with their own information as well.
So poignant you say that. Trevor, because as you said, data lives in various, various and different sources. It could be anything from, as you said, the census data. It could be transport data, weather data that could make a difference, right?
Absolutely.
We have different rulings too on patient data because it's a health charity. So patients who are referred to us obviously are giving us personal information. And so we also have to link that to confidentiality policies and statements of how their data is used and stored, and what if we do research on that data, how that would be used, and is it de-identified. So there's a real sensitivity point there, but there's also a legal responsibility with that data. I suppose also I break data into, if you, in an easy way, is internal and external to my organization. From an operational perspective, I look at, I'm a change management CEO, so I often come into charities or not-for-profits who've got data that's replicated everywhere. That's right, as Trevor was saying, it's on, say a stakeholder spreadsheet. Someone's got one, the next staff member, 6 staff members could have their own, which is developed over years. It's their little black book, right? So actually getting that into a CRM and being able to get consistency of data and everyone in that same, out of their silos and into a team approach, an open visibility approach. I think that's a huge transition for particularly older workers who've worked in a certain way. So I think that is great. One, pulling as much into one core source, which is a CRM. The other bit is also then you've got data on the flows, the operational manuals. How does our team actually work? If someone wasn't here, went on leave, was replaced, how is that data communicated and also stored and used, rather than, the old view of you write a beautiful policy and then it gets stuck somewhere and no one actually revisits it. So how does it actually become operational? And particularly, it's also got a link from an external point of view. Our job, we've got key targets and that should influence our data. And so, for example, we've got a KPI to have 300 patient referrals a month at the moment. And so therefore I need to go, okay, well, how am I measuring those 300 referrals? What is the source that they're coming from? They might come from 5 different channels, a doctor, of the website, whatever. I need to actually have visibility on that data because I want to know what's working and what's not, right? There's no point being an eye health charity and thinking 90% would be coming from the doctors when actually they're coming from a pharmacist, or they're coming from, a different campaign, from one of our ambassadors. Kirk Pangilly might have done that, and they're coming via his message. So that will help me improve the quality of my service delivery because of the analytics of that data. So it's really quite, I love this topic.
And that speaks to, Annie, to what Pat said earlier about having your data linked to your business strategy, because there's no point having all this data if we don't use it meaningfully, right?
Oh, so true, Rachel. Like we actually had that problem that when we first started a new referral pathway, we asked for too much data, which is amazing, right? You think, can you have too much? Well, yes, you can, because if it wasn't necessary for our KPIs, we were going too broad. We needed to get more focused. Also, the more you ask a client or a customer, the more threatened they get with data. So it was actually, by the time you've asked them 10 questions, you've kept them on the phone too long, they're not feeling as confident. Whereas if you just ask them for 3, and then build that data over time, establish that customer journey after they've had 3 touch points, 5 touch points. They'll give us pretty much after a year, they'll tell us anything we need to know. But it's the time of data as well.